Hey guys, welcome to my channel. Tonight we have a quick video talking about sugar and how it affects our kidneys. And I'm going to get right into the video because time is short and I want you to hear the 5 points that she has. So let's go.
I'm a board certified kidney doctor, and so I can tell you firsthand that diabetes is the number one cause of kidney failure. And we all know that sugar is a big concern these days, especially if you have diabetes. But do you know what it is actually doing to your kidneys every single day? It's not an overnight event, no. It's actually a quiet process that can be occurring over years. In this video, I'm going to give you 5 ways that sugar can seriously be damaging your kidneys. My goal is to give you the knowledge you need to protect yourself. I'm going to do this by looking at 5 stages of change. We'll talk about how your kidneys can be overworked and worn out. And then we'll talk about how this overworking can actually lead to permanent scarring of your kidneys that in some cases cannot be reversed. We'll also talk about the number one sign that your kidney filters are leaking, which is a problem. We'll talk about how sugar can clog your pipes, how it can clog your blood vessels in your kidneys, which can cut off proper blood supply and oxygen. And we'll also talk about the sneaky way that diabetes can affect your bladder, which can hurt your kidneys. After watching this video, you'll not only be scared of sugar, you'll be smarter than it. And you'll be able to talk to your own doctor with more confidence, and you'll understand what's really on the line when it comes to kidney disease and diabetes. You'll also have the drive to make changes in your own diet so that you can be healthier in the long run. Keep watching. Be sure to download your copy of my book. It's called Under Pressure. It's your step-by-step guide on how to control high blood pressure. This book is packed with valuable tools, guidelines, and information to help you to control high blood pressure. Click the link in the description to get your copy today. Please be sure to go ahead and like this video because I'm about to give you some evidence-based medical information. And make sure you subscribe to my channel if you haven't already and click the notification bell so you'll be among the first to know when I release new medical content. All right, let's go ahead and get started. Here are 5 ways sugar can be wreaking havoc on your kidneys. Number 1, the overworked filter, hyperfiltration. Think of your kidneys as having millions of little delicate filters, and their responsibility is to clean out your blood, right? To filter your blood. Well, when you have excessively high amounts of sugar in your blood or hyperglycemia, then this causes the kidneys to have to work harder and go into overdrive in order to filter. This is called hyperfiltration, and so it overworks the kidneys. If you compare your kidneys to a coffee filter, for example, everything is fine when the coffee filter just has a normal stream. But if you were to take a big old fire hose and put all that pressure on the coffee filter, it would cause the filter to stretch, to be distorted, and to not work properly. This is what happens when your kidneys are constantly exposed to high sugar. They go into overdrive from the hyperfiltration, and you actually damage your kidneys. So here's one thing you can do. First thing in the morning, start off with a glass of water, perhaps a glass of warm lemon water. When you drink the water, this is one way to help to support your kidneys filtering. And then of course you want to make good choices when it comes to sugar throughout the day. When it comes to lab work, ask your doctor for your EGFR, estimated glomerular filtration rate. This lets you know how well your kidneys are filtering. But remember, we're talking about hyperfiltration early in diabetic kidney disease. And so your EGFR might initially not only appear normal, it might be high or hypernormal. This is not necessarily a good thing. It could be a sign that your kidneys are being overworked and that there's hyperfiltration. And so make sure you follow this EGFR with your doctor over time to see what's going on with your kidneys. Ultimately, you want to make good, smart food choices, like eating foods with lots of antioxidants, like blueberries, strawberries, raspberries, spinach. This is another way to support your kidney filtration. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. Number 2, permanent scarring or glomerulosclerosis. So these kidney filters you have are called glomeruli. And if they're overworked over time, then they can be damaged and be scarred, which is the glomerulosclerosis. So yeah, all that hyperfiltration and being overworked, over time, it can cause scarring. Just like your skin. If your skin has injury, you get scars there. If you think about that coffee filter example, imagine if the coffee filter gets little points of dried glue. Somebody puts glue on it. Well, at each point where you have the glue, then the coffee filter won't filter very well, right? It'll be stiff and it really won't be helpful. So over time, if someone put more and more little bits of glue on that coffee filter, then the ability of the coffee filter to filter would get worse and worse, okay? This is what happens to your kidneys. Over time, after they've been overworked by having to filter out your high blood sugar, eventually you get scars and more and more and more glomeruli, and that actual scarring, the glomerulosclerosis, is unfortunately not reversible. That's why you want to stop it early on and try to do things to reduce the kidney damage before it gets to the point of scarring. So here's one step you can take. After you eat your biggest meal of the day, just take a 10-minute walk. This will help your body to use the glucose in your body more efficiently. It will help to prevent you from having such high blood sugar or hyperglycemia, and this can cause less damage and ultimately less scarring to your kidneys. As far as lab work, again, you want to ask your doctor about your eGFR, that estimated glomerular filtration rate, because by the time you get to the point of having kidney scarring, that eGFR will be low. For example, if your eGFR is less than 60 but greater than 30, then that is CKD stage 3, chronic kidney disease stage 3. If your eGFR is less than 30 but higher than 15, then that is CKD stage 4. There are 5 stages of chronic kidney disease. Be sure you watch my video on CKD stages after you finish watching this video. As far as smart food choices, try to incorporate foods that have healthy fats like avocados, olive oil. This is a way to help to reduce the inflammation in your kidneys, and we know that it's the inflammation that can ultimately lead to permanent kidney scarring. We're talking about kidney health and diabetes, but of course, I like to promote your health overall. And so guess what? I have a freebie for you. If you click the link in my description, I have a free PDF download on 10 healthy habits for a better you and a better life. These are the habits I use in my everyday life as I try to live my happiest, healthiest life. Go ahead, check it out, and I guarantee it will help to make your life better. Number 3, the leaky filter, proteinuria. So we've already talked about how when you have high blood sugar, it can overwork the kidneys, cause hyperfiltration, and lead to kidney damage. If you get a lot of kidney damage or scarring, that can lead to glomerulosclerosis and a decline in your eGFR. Well, another thing that can happen with damaged kidney filters is that they can leak. And what they leak out can be important proteins like albumin. If you think of your kidney filters like screens, okay, like a screen on the door, well, that screen is meant to keep bugs out, right? But if you get rips in the screen, if there are tears that make the little fine holes bigger, well, then the bugs will start to get in, okay? Well, the albumin or the protein is like the bugs, and your kidney filters are like the damaged screen on a door. So here's one thing you can do to help to decrease the leakiness of your kidney filter. Well, manage your blood pressure. And one way to do that is to have a low salt diet. According to the American Heart Association, most adults should have no more than 1,500 milligrams of sodium or salt a day. If you have high salt in your diet, it tends to make you hold on to fluid inside of your blood vessels. And the more fluid you have in those blood vessels, the higher pressure on those blood vessels, leading to hypertension or high blood pressure. Well, if you have high blood pressure in the vessels in your kidneys, in those kidney filter vessels, well, that high pressure will make you push out more protein, okay? In other words, if you have an uncontrolled high blood pressure in your kidney filters, that pressure causes your filters to leak more. So having a low salt diet by being a label watcher is one way to decrease proteinuria. Do you have any questions about kidney health that you'd like me to cover in another video? Please comment down below. If you suspect that you have a leaky filter or proteinuria, the lab you should ask your doctor for is a UACR, or a urine albumin to creatinine ratio. This will allow your doctor to pick up whether or not you are leaking albumin, that protein, into your urine. And if you are, then it can inform your doctor of what steps need to be made to decrease the leakiness of your filter and to help to slow down the progression of diabetic kidney disease. Oftentimes, we're able to pick it up in these tests way before you ever see any signs of having a leaky filter. And a sign of a leaky filter or proteinuria is foamy urine, foamy or bubbly urine. Make sure you watch my video on foamy or bubbly urine after you finish watching this video. If indeed you do have a leaky filter, here are some smart food choices. Make sure that you eat lean proteins like beans, fish, the white meat of chicken with no skin. It is important that you maintain a certain amount of protein in your diet, but it needs to be the right protein and the right amount. If you have too much protein, then that's something that could worsen your proteinuria. For patients with advanced kidney disease, oftentimes we recommend anywhere from 60 to 80 grams of protein a day. Make sure you consult with your doctor and your registered dietitian to know the amount of protein that's appropriate for you. Question: after watching this video, what is one small change you are ready to make today to cut back on sugar? Please comment below. Number 4, the clogged pipes, blood vessel damage. So when you have high blood sugar or hyperglycemia, that blood sugar is actually toxic or poisonous to your blood vessels. And inside of your kidneys, those kidney filters, there are many, many little tiny blood vessels, okay? Like little tiny pipes. If you have excessively high blood sugar, then it damages the lining on the inside of those blood vessels, causing the blood flow to not be what it should be, and it can also cause you to have a high blood pressure. Not only a high blood pressure inside of the kidney filters, but it can lead to you having high blood pressure systemically, high blood pressure throughout your body. Think of the blood vessels in your kidney filters like the pipes that run in your home. If your pipes have a lot of rust, that rust can clog them and cause them to be narrow as far as the water flow through pipes. And if you have narrowed pipes, that causes a backup, right? And you can get a high pressure in the pipes, but then still not be getting the water flow that you need. Same thing in your body. When those kidney vessels are clogged due to the damage from high blood sugar, you can get a backup causing a high pressure, not only in the kidneys, but a high pressure in your body, and the kidneys just won't function as well as they should as far as filtering your body. Here's one step that can help you to kind of monitor what's going on as far as the pressure. In your home, check your own blood pressure. Yes, monitor your blood pressure at home. Make sure that your body is in the right position, that you have the proper size blood pressure cuff. Be sure you click the link in my bio or visit drfrida.com, and I share some of my favorite home blood pressure cuffs. Remember, the lower your blood pressure in your body, the lower the pressure in those kidney filters, and that's going to be helpful for your overall kidney health. As far as the labs to ask your doctor for, hemoglobin A1C is an excellent one. The hemoglobin A1C is a measure of what your blood sugar is. And the good thing about the hemoglobin A1C is that it's not just a snapshot of how your blood glucose or blood sugar is at one particular time. The hemoglobin A1C actually gives us an average of what your blood sugar has been over the past 3 months. It really lets us know how well your blood sugar is being controlled. Remember that if you have a hemoglobin A1C of 6.5 or higher, that is consistent with the diagnosis of diabetes. And so you want to consult with your doctor to make sure you keep this hemoglobin A1C at a lower level. A smart food choice to help with these clogged pipes or this blood vessel damage: foods high in omega-3 fatty acids like fish and walnuts. When you eat these foods, then it helps to improve the flexibility of your blood vessels and your overall kidney health. Number 5, the communication breakdown. Nerve damage. Now, here's one that people often forget. Diabetes and high blood sugar actually damage the nerves, okay? They cause neuropathy. You might recall that people will get diabetic neuropathy. They might have tingling or numbness of their toes or tingling and numbness of the fingers. But guess what? You can also get nerve damage to your bladder. And this can be a big issue in your kidney health. If you develop nerve damage to your bladder due to the diabetes or high blood sugar, this can cause an issue, and it can keep you from knowing when your bladder is full and when you need to empty it. And it can also cause you to lose control of your bladder and have urinary incontinence. Now, if you are unable to fully empty your bladder and you get a backup of urine, well,
Guys, hold on. We are going to get the ending part in just a second. Let's get over here and get this one so we can hear.
ureters, okay, those are the tubes that connect your bladder to the kidneys, and
Okay.
you can get something called hydronephrosis, which is a backup of urine in your actually kidneys, and it causes a pressure and an enlargement in the kidneys, and it can lead to kidney damage. So yes, all of this can happen due to a breakdown in communication from nerve damage and diabetes. The other thing that can happen is that if you have a backup of urine, you're not completely emptying your bladder, then that increases your risk for a UTI or urinary tract infection. If you have a urinary tract infection in the bladder and you also get it in your kidneys, so a kidney urinary infection, a kidney infection is called pyelonephritis. If you get this backup of urine in your bladder and it causes you to have infected urine in your kidneys, then that can lead to recurrent pyelonephritis, which can also lead to kidney damage. So yes, having high blood sugar is a sneaky way to damage your kidneys just from having a breakdown in communication or diabetic neuropathy that affects the bladder. If you think of your bladder like a sink, that might make sense. So if you have a sink and you put water in it, as long as you empty that water, okay, if you let the water go down the drain regularly, then the water will be relatively clean. But if you allow the water to just sit there over time, it will collect dust, dirt, and it will become unclean, right? Same thing with urine that just sits in the bladder. It's more likely to become infected if you have a backup of urine in your bladder. One thing you can do to prevent this backup of urine is have timed voiding, or a set time to empty your bladder. So I recommend going to the restroom every 2 to 3 hours, even if you don't feel like your bladder is full. That is one good way to prevent having this backup of urine, which can lead to complications. As far as labs to ask your doctor for, there's no one particular lab. You can certainly request a urinalysis with micro and a urine culture to see if you actually have a urinary tract infection. You can also ask for imaging or an ultrasound that includes not only the kidneys and the ureters, but an ultrasound that also includes the bladder. And this can let your doctors know if even after you go and urinate and you try to empty your bladder, it'll let them know if you still have a backup of urine, if you have a post-void residual, or if you still have residual urine in your bladder even after you try to empty it. So that's one thing that can help. And if you find that you really are having nerve damage to the bladder, then ask your doctor to refer you to a urologist. This is a kidney and bladder and prostate surgeon. So when you go to the urologist, they won't necessarily grab you in there and put you on the operating table right away. No, they do assessments. They can do something called urodynamic studies, and it can really let them know exactly what's going on as far as any nerve damage in the bladder. As far as some smart food choices, if you have nerve damage to the bladder, a high fiber diet. Things like whole grains, lentils, vegetables. Here's how it relates. If you have a diet that's high in fiber, then you are less likely to be constipated. And if you are constipated, that can actually cause pressure to be put on the bladder, and that pressure can prevent you from properly emptying your bladder. So making sure you have a high fiber diet and that you prevent or avoid constipation is one way to keep you from retaining urine in your bladder. So now you see that your blood sugar is more than just a number. It's something that can seriously damage your kidneys by overworking them, scarring them, causing them to be leaky, damaging the blood vessels, and even the blood sugar can cause you to have a backup of urine in your bladder. Make sure that you follow up with your doctor regularly. Know what your blood sugar is. Know what your hemoglobin A1C. Make sure that you're screened for protein in the urine when appropriate. And very importantly, if you do develop kidney damage, be proactive and ask your doctor to refer you to a kidney doctor or to a nephrologist like me. If you found this video to be helpful and informative, please be sure to like it and to share it with the people you care about.
Guys, thank you so much for liking, for excuse me, for watching the video. I pray you liked the video. I pray it was informative. And yeah, leave a comment. So I'm going to see you in our next video. Thank you for coming.